Your physiotherapist may have recommended you to do some airway clearance techniques, and these are important to help prevent infection. So the aim of this exercise is to help clear the lungs of any phlegm that might be there, so that bacteria can't sit in the phlegm in your airways and cause infection. You want to complete as many cycles of this exercise as it takes to clear your lungs fully. So this is a PEP mask, and PEP stands for positive expiratory pressure. So as you breathe out into your PEP device, you'll feel resistance to the breath out. And that resistance causes a bit of a back pressure into the airways to help splint the airways open. And that can be helpful because it allows the phlegm to clear from your lungs without it getting trapped in your airways. You're aiming to do 10 to 12 breaths out through the PEP mask, and you want these to be long, steady breaths. Your physiotherapist will have decided which size of valve is the right one for you. So you're going to do 10 to 12 breaths out through the PEP mask. You'll feel the resistance on each breath. Try not to take the mask off your face in between those 10 to 12 breaths because it helps to build up the pressure in your airways. And after those 12 breaths, you're going to follow it with 2 huffs. You want your 2 huffs to be long and strong all the way to the bottom, aiming to clear the phlegm out of your airways. When you do your huff, you want a wide open mouth and listen out for any phlegm that might be there. You might hear some crackles in your huff, and you're aiming at the end of the exercise for that huff to be clear and dry. So once you've done your 10 or 12 breaths with your PEP mask, followed by 2 huffs, if there are secretions high up enough to clear, then clear those out of your airways. And if not, hang on and go back to the beginning and clear them when they're ready to come. You want to complete that cycle of using the PEP mask and huffing as many times as it takes to clear all of the phlegm from your airways. Your physiotherapist will help to work out how often you need to do this exercise. It might be once a day, it might be twice a day, for example in the morning or in the evening. When you're doing this exercise, make sure to complete several cycles together of using the PEP mask and the huffing, because phlegm can be quite stubborn and it might not all clear on the first cycle. So you want to do several cycles together and to repeat that as frequently as your physiotherapist recommends.